The NHS faces considerable challenges, and what we're doing is really not much different to other parts of the country, except we are ahead of the game and we're planning for the future. We know that as the population is getting older, which is a success factor for the NHS, it means it's working well. We have to make sure that we can provide the best possible care for all of the people that we have in our population. And so we have to think how best to do that. We have a significant amount of resource to spend on the NHS and social care, and we have to make sure that every penny is spent as wisely as we can to get the best care for everybody. And so that's really why we're trying to change services to make everything work more effectively and more efficiently together. And we have to act now. If we don't, the services will become more unsustainable, quality will suffer, that we will be spending more money than we can afford, and we will then have to make more short-term decisions going forward. So planning for the future allows us to have the best legacy of services for our population. Key changes will be staff will be able to work more closely with teams from other parts of the NHS and social care. So hospital staff are more likely to work more closely with community staff going forward. And where it's appropriate and staff are willing to, more likely to work probably in more than one setting. So some hospital specialist staff may come out and do more community clinics. So it will be about teams forming in new ways and possibly working in more settings. Although the Better Together programme is over 5 years, we are already making some changes so patients can see some changes already this year. One of the key things is we've invested a lot into community teams. So district nurses are working with mental health workers, social workers, therapists, sort of more rounded way of caring for people in a much more individual way and a more joined up way. And people are saying that they feel much more supported by these teams than they used to in the old system. So we're already seeing some benefits. We're also making it easier for people and joining up GPs within emergency departments in mid-Nottinghamshire. We expect that to happen later this year. So there are a number of things that people will start to see as improvements, but the full effect will take 5 years. As we go through the programme, we're involving patients and members of the public in developing our plans at every step of the way. We have a citizens board with representation from all of the areas, Mansfield, Ashfield, Newark and Sherwood. We have a variety of groups, and patients and representatives are on the groups and helping us to shape our plans. We have a website and people can contact us through the website. We know that if we make significant changes to our services, that we have a responsibility to hold a formal consultation with our local population, and we will do that. It's too early to say yet whether that's going to be necessary, and no decisions have been made, but we will review that again in the autumn of this year. Better Together is going to be good news for patients. We've been ahead of the game with thinking ahead, planning ahead and thinking what does our population need now, but also in 5 and 10 years' time. So we're reshaping services and shaping them so that patients can benefit, carers can benefit, and members of the public can benefit by taking more control for their health, their lifestyles, preventing ill health where possible, making sure that if people do need hospital care, that they're in for the shortest amount of time possible so they can get back to their home and their loved ones as quickly as possible.